Hello बच्चों and coming to the last clinical anatomy case discussion, case number 10. सब ठीक है? क्या हाल है? सब समझ में आ रहा है? लोअर लिम्ब कॉन्फिडेंस आ गया? चलो एक आखिरी एमसीक्यू डिस्कस कर ही लेते हैं अब, है ना? सारे टॉपिक्स तो हमने डिस्कस कर लिए. कमिंग टू द लास्ट एमसीक्यू ऑफ दिस सीरीज, हैव अ लुक. A 40 years old teacher has a tortuous and dilated veins. बच्चों, tortuous and dilated veins, saphenous, I mean the varicose veins. टीचर है, मिल वर्कर है, लेबरर है, who stands for a long period of time. क्या होता है? varicose veins. So something to do with varicose veins. Has tortuous dilated veins along the medial aspect of the leg and the thigh. Medial aspect of the leg and the thigh. What comes to your mind? Medial aspect of the leg and the thigh पे वो कौन सी बड़ी vein है? That's the great saphenous vein. Lateral aspect of the leg, short saphenous vein. So medial aspect पे great saphenous, lateral aspect पे होती है अपनी short saphenous vein. And worse after prolonged standing. So tortuous dilated veins है, 100% varicose veins है, medial aspect of the leg and the thigh है तो great saphenous vein होगा, lateral aspect है तो short saphenous vein. Which superficial vein is involved? You're understanding which superficial vein is involved? That's the great saphenous vein. Great या long saphenous vein बोलो same है. Great saphenous vein. Okay, पहले तो देखते हैं how is this great saphenous vein formed? How is this great saphenous vein formed? So that's a dorsum of the foot. On this dorsum of the foot अपने पास एक arch होता है जिसका नाम है dorsal venous arch. Dorsal venous arch. ठीक है? इसका medial end है, lateral end है. There's a vein which comes from the great toe. There's a vein which comes from the little finger. इसे क्या बोलते हैं? Medial marginal vein. Medial marginal vein. And this is going to be the lateral marginal vein. Medial marginal vein, lateral marginal vein. So medial marginal vein joins with the medial end of the dorsal venous arch. ठीक है? Medial end of the dorsal venous arch के साथ ये medial marginal vein join होती है, and this is the great saphenous vein. Great saphenous vein या long saphenous vein, anything will do. What is this vein? That's a short saphenous vein. Short saphenous vein. Now this great saphenous vein goes in front of the medial malleolus, right? ये बहुत important MCQ है. The great saphenous vein goes in front of the medial malleolus, accompanies the saphenous nerve. ये saphenous nerve के साथ जाती है. Now runs on the medial aspect of the leg, comes to the medial aspect of the thigh and goes into the femoral vein. ये कहाँ पे drain होती है? Femoral vein में drain होती है. So if that's the femoral vein, that's a great saphenous vein. That's a great saphenous vein which drains into the femoral vein. What is this vein? Femoral vein. And before it enters the femoral vein, ये cribriform fascia को pierce करेगा. Before it enters the femoral vein, it receives 3 tributaries. 3 tributaries मिलते हैं इसको. What is this? The superficial circumflex iliac. Superficial circumflex iliac. Superficial external pudendal, superficial external pudendal, superficial circumflex iliac and superficial epigastric. Superficial epigastric veins. ये 3 tributaries है. मतलब great saphenous vein कैसे form हुआ? By the joining of the medial end of the dorsal venous arch with the medial marginal vein. Now this vein runs in front of the medial malleolus along with the saphenous nerve. Goes on the medial aspect of the leg, medial aspect of the thigh. अब ये cribriform fascia को pierce करेगा and the great saphenous vein would drain, then open in the femoral vein. Before opening in the femoral vein, 3 veins it receives: the superficial circumflex iliac, superficial external pudendal and the superficial epigastric veins. ठीक है? अपने पास superficial veins होते हैं. Superficial veins. Then we have deep veins and we have perforating veins. perforating veins. So the blood will flow from the superficial to the deep vein through the perforating veins. The blood will flow from superficial to deep vein through the perforating veins. अब superficial veins में valves होता है, perforating veins में valves होते हैं. अगर ये valves damage होते हैं तो what we get? Varicose veins. Details lectures देखना. For details of this veins, details of this valves, कितने valves हैं, कहाँ पे होते हैं, just see the lectures. Right? This is only clinical case discussion बच्चों. Okay. So which superficial vein is mostly involved? Great Saphenous Vein. Where does it terminate? Yes, come on. Terminate कहाँ पे होता है ये? It terminates in the femoral vein. है ना? ये terminate कहाँ पे होता है? Femoral vein after piercing the cribriform fascia. Name the three tributaries: superficial epigastric, superficial circumflex iliac, superficial external pudendal. ये तीन tributaries है. One key reason standing worsens the symptoms. What is that? Damage to the valves. Damage to the valves. So जब ये valves damage होते हैं, the vein cannot hold the blood, तो वो dilated and tortuous veins होते हैं. That's varicose veins. ठीक है? So varicose veins can be due to damage to the valves of the superficial veins or the damage of the valves of the perforating veins. Perforating veins के भी valves damage हो गए तो you get varicose veins. बच्चों, I hope I'm clear to you. समझ में आ रहा है? कुछ doubts है? Clear? So superficial veins, deep veins, perforating veins, superficial veins के valves damage हो गए, perforating के damage हो गए तो varicose veins होते हैं. You understood the great and the short saphenous vein, उसका course कहाँ पे terminate होता है, उसके tributaries. Right students? I hope I'm clear to all of you. चलो, great, very good. And आखिरी में जैसे हमेशा मैं देता हूँ, yes, one clinical MCQ for you. Great saphenous vein drains into. Answer this MCQ in the comment box. बच्चों, I'm sure ये पूरा series you have understood well and you've got confidence. अगर कुछ भी doubt है, कुछ clear नहीं है, कुछ queries है, तो definitely ask me. This will help me to improve on my quality. ठीक है बच्चों? Once again, that's my Telegram channel. That's my Insta handle. You can log into this. आप ये देख सकते हो, इसमें काफ़ी MCQ oriented चीज़ें मैंने दी हैं. That's my YouTube channel. बच्चों, देखते रहिए क्लिनिकल केस सीरीज एंड बाकी के टॉपिक्स भी मैं धीरे धीरे अपलोड कर ही रहा हूँ. राइट? सो क्लिनिकल केस ऑफ अपर लिम्ब इज डन, लोअर लिम्ब इज डन, एंड बाकी क्लिनिकल केसेस वेल अपलोडेड, प्लस टॉपिक्स भी अपलोड कर रहा हूँ. ठीक है बच्चों? थैंक यू वंस अगेन फ्रॉम द एंटायर टीम ऑफ एनाटॉमी अनलिमिटेड. सी यू वंस अगेन. थैंक यू. बाय बाय.